Many people associate children with deworming, not knowing that adults also have high risk of developing worms. Now I'm going to ask you a very simple, honest question. When did you deworm last? It's okay. Maybe 1 year ago, 3 months ago, or you have never dewormed at all. Worm pose high risk in adults just like in children. So my people, I want you to watch this video that I'm going to teach you more about worms. I'm going to tell you some types of worms that cause problems in adults and children, their names, signs and symptoms, prevention, and eventually how we can manage them. Welcome to Family Vlogs, and if you have not subscribed to this channel, hit the notification bell, hit and subscribe for more videos that I make. Number one worm is threadworm or pinworm, the one known as Enterobius vermicularis, and is popularly known for causing itchiness in the anus of human beings. So if you get somebody complaining of anal itchiness or constantly scratching his or her anus, know that this person might be suffering from enterobiasis or pinworm or threadworm. But there are some conditions that may also subject one to scratch his or her anus. Number two is Ascaris lumbricoides or ascariasis or roundworm. This normally causes abdominal distension, nausea, vomiting, abdominal pain in children, and it can complicate to anemia or causing intestinal obstruction. It has been found that sometimes you can get a child developing abdominal distension, or even adults, which is very rare. When taken to theater, almost 10,000 of worms, of roundworms, these Ascaris lumbricoides, are extracted. This is why we want our people to deworm, so that they cannot end up being taken to theater for surgery because they have intestinal obstruction due to worms. Third worm is called hookworm, that is popularly known as Neceta americanus or as Cyclostoma duodenale. Is very, very important in that normally we get this by walking barefoot, and the hookworm normally penetrates in our bare feet and travels to the bloodstream, causing problem in human beings. And this is why we encourage people not to walk with their feet bare. You can also get exposed when you use human feces as fertilizers, and you come into contact with the soil which has been infected, and these larvae normally penetrate your skin, causing skin rash and itchiness. Then they travel to the bloodstream and they start causing signs and symptoms in the lung, like slight cough, and then they are swallowed again, coughed outside, whereby they also attach themselves into the intestinal mucosa and they start circling your blood, and you may develop anemia in this particular condition. So it is very, very important. Fourth one is whipworm, which is normally named after its shape. It resembles a whip. In fact, this one we normally get into contact with it if we get into contact with contaminated food or contaminated fruits, vegetables, or when we use human feces as fertilizers. That's why we encourage each and everyone to wash his or her hands, and make sure your children wash their hands before they eat, because this one causes bloody diarrhea, and it can even complicate to rectal prolapse. Of course, general signs and symptoms just resembling others: abdominal pain, abdominal distension, fatigue, etc. Fifth worm, which is very, very dangerous, and we can get them both from eating pork, that is Tinea solium, and eating beef, that is Tinea saginata, can even cause complications that we might think that we have meningitis, but it is only Tinea species that is causing convulsions and fits in human beings. And this is called tapeworm, and it is segmented flat worm that normally we get from eating beef or eating pork, and normally causes abdominal distension, abdominal pain, fever, fatigue, diarrhea, and vomiting. And if it complicates, it might even go and form a cyst in our major organs like liver, spleen, and this one can cause an organ failure. So it is very, very important for an individual to deworm to avoid this. Sometimes as medics, we might be struggling to be treating meningitis and a patient has a complication of Tinea solium or Tinea saginata. Tinea solium and Tinea saginata can complicate and cause brain damage, and a patient can develop neurological deficits and even convulsion fits. And you might even think that this patient is having epilepsy or meningitis, only realizing that he's suffering because of Tinea solium or Tinea saginata, and this one is normally detected when we do brain or head CT scan. The causes of these worms, we normally get them from contaminated water, contaminated soil, using human feces as fertilizer when we get contact with them and we don't even wash our hands, eating raw meat, eating partially cooked meat, partially cooked fish, partially cooked vegetable or unwashed vegetable, general poor hygiene and poor sanitation is what normally lead to getting contact with worms. So ladies and gentlemen, if we reverse those, then we will prevent worms. Generally, signs and symptoms of worms are not distinct. Only some few cases are distinct, like in the case of Enterobius vermicularis, which normally causes anal itchiness. Mostly it is gastrointestinal and central nervous system. We may develop nausea or vomiting. Sometimes we may develop mild cough or throat pain, particularly when the worms are invading the lungs. And sometimes we may develop abdominal discomfort or abdominal pain. And sometimes you may get some patient developing bloody stool or itchiness in the anus, like I've said it, or difficult in defecation or defecation associated with stool, that is passing feces with blood. In central nervous system, a patient may develop fever, that one now in advanced stage of worms, and may develop fits, that is convulsions, and also develop headache in this scenario. So signs and symptoms might not be so specific. In some cases, patient may develop general body tiredness, that is general body malaise, and even see feces having worms in them. And this is very distinct, and this one may also prove that the patient is suffering from generally worms. If we reverse causes of these worms, we will lead to prevention. Make sure you boil water, make sure you wash your hand. When you use human feces as fertilizer, make sure you wash your hand. Make sure that you boil meat or cook meat very, very well, or fish or small fish very, very well. And make sure you don't walk with your feet bare, so that you prevent getting worms. General sanitation and good hygiene is very, very key in prevention of worm. Just like any other disease, worms can also complicate when they are in large numbers into your body. First of all, it can cause intestinal obstruction, and this is known with infestation with roundworms, that is Ascaris lumbricoid. It can even cause permanent head damage, like the cysts that I've been talking about of tapeworm. It can lead to other organ failure like eyes, brain, and liver. It can also lead to growth retardation, and depending on how a patient is presenting to us as clinicians, we will do necessary investigation to make sure that you have worms or you don't have worm for proper treatment. Of course, we will send you to the lab for stool analysis. That one, in the laboratory, you will be told to produce your feces. We call it stool, for it to be examined, for it to be seen, for it to be looked at under microscope, so that they can verify which type of worm you have. Sometimes we can even do CT scan, particularly of the head. We can also do abdominal ultrasound if we suspect you have abdominal distension or massive infestation of worms into your abdomen. Or we can also go ahead and do MRI. eye, that is magnetic resonance. This video is a challenge to adults who normally don't deworm, and we encourage all adults to come to the facilities for proper checkup and eventually deworming. And we also encourage you to continue with the same spirit to bring your children for deworming. Of course, government is doing a very great job in mass deworming of school children, particularly giving them the drugs that are necessary for deworming. That's a single dose of either albendazole or mebendazole. So ladies and gentlemen, if you love this video, subscribe, hit that notification bell written subscribe, turn it on for more videos that I will post. Muchas gracias.